Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. So this video is mainly for the nursing aspirants who are preparing for their competitive examinations. Today we are going to see the MCQs for the nursing officer examination on the subject Pharmacology and Microbiology with the rationals. So far we have discussed many subjects like fundamentals of nursing, pediatric nursing, gynecological nursing. So here most of the competitive exams, the least concentrated subject is pharmacology and microbiology, but even though to score good marks we have to study the pharmacology and microbiology also. So I have picked certain questions which was repeatedly asked in the competitive examinations. Without wasting much time, we'll get started. So first question, who discovered antibiotic penicillin? Option A, Alexander Fleming. Option B, Edward Jenner. Option C, Waxman. And option D, none of these. So according to this question, the antibiotic penicillin is being discovered by Alexander Fleming. And second question, a drug prevents the absorption of poison from the gastrointestinal tract. So any oral poisoning, if we are taking this drug, it will prevent the absorption of the gastrointestinal system. So sometimes we don't know what is the antidote, what poison they have taken. In that case, what we can administer? Option A, disulfiram. Option B, proladoxim. Option C, activated charcoal. And option D, injection atropine. So in this case, if we don't know what is the antidote and what poisoning they have taken, we can give the option C, the answer, activated charcoal. This activated charcoal will prevent the absorption of the poisons from the gastrointestinal tract. Next question, a patient has undergone mitral valve replacement having persistent bleeding from surgical incision in the early postoperative period. Which drug will be administered? So here the option A, protamine sulfate, and option B, vitamin C, option D, quinidine sulfate, and option D, warfarin. So here in this question they have given that the patient has undergone mitral valve replacement and they are having persistent bleeding from the surgical site. So there is a chance maybe the overdosage of heparin. So what is the antidote for heparin? The option A, protamine sulfate. So I have already uploaded a video about the drugs and the antidotes. So it will be easy for you to learn those poisoning and antidotes in easy way. So I will pin that video in the description box. Kindly go through this video also. So according to this question, the antidote for heparin is protamine sulfate. So they have given as a hidden in the question itself. So they have given a hint like persistent bleeding. So next question is, the first drug of choice to treat an anaphylactic reaction is. So for anaphylactic reaction, what is the first drug we have to administer? So here the option A is corticosteroids, and option B is epinephrine, option C is antihistamine, and option D is bronchodilator. So any anaphylactic reaction we have to administer the drug is option B, epinephrine, that is injection adrenaline. So next we'll move on to the next question. The most important nursing intervention on a patient receiving prednisolone. So for prednisolone, what is the most prior nursing intervention? We will do it. So first one, option A, check urine output Harley. Option B, check Harley urine specific gravity. Option C, check blood sugar Harley, and option D, check blood level of the drug. So when we are administering prednisolone, there is a chance of having the adverse reactions like sodium retention, weight gain, and hyperglycemia. So among these options they have not mentioned about the measurement of sodium. So here in option C they have given check blood sugar Harley. So if we are giving prednisolone, there is a chance of hyperglycemia. So only we have to check the Harley blood sugar level to identify whether the patient is going into hyperglycemia or not. So here the answer is option C, check blood sugar Harley. Next question, what are the values of temperature and time employed for autoclave in a routine bacteriological laboratory. So for autoclaving, what is the time we have to give? So option A, 132 degrees Celsius for 8 minutes. Option B, 140 degrees Celsius for 25 minutes. Option C, 110 degrees Celsius for 30 minutes. And option D, 121 degrees Celsius for 15 minutes. So in case of autoclaving, the ideal temperature is option D, 121 degrees Celsius for 15 minutes. So usually for autoclave we use 121 degrees Celsius, that is 250 degree Fahrenheit, and for 15 to 20 minutes. If it is unwrapped things, it has to be kept for 15 to 20 minutes. If it is a wrapped thing, it has to be kept for about 30 minutes. So depending upon the what material we are autoclaving. So this is the ideal temperature for the autoclave, that is 121 degrees Celsius for 15 minutes. And pressure we use about 15 lb pressure. So next question is, sterilization of glassware is done through. So for glasswares, what method of sterilization we are using it? So option A, dry heat. Option B, fumigation. Option C, moist heat. And option D, disinfectant. So for the sterilization of glasswares, we use dry heat. So for scalpers, forceps and scissors, and for glasswares we use a sterilization method is dry heat method. So next question, the process by which medium is placed at 100 degrees Celsius in flowing steam for 30 minutes each on 3 successive days. So option A, steam under pressure. Option B, autoclave. Option C, tinderlization. And option D, inspissation. So here it is already given the answer, option C, tinderlization. So tinderlization is a process that we are going to place the medium in about 100 degrees Celsius in a flowing steam for about 30 minutes for 3 successive days. So for 3 successive days is the key point here, that means tinderlization. Next question, which of the following is used to destroy HIV contamination caused by body fluids of HIV patient? So here among the 4 options, option A, Dettol, option B, Savlon, option C, sodium hypochlorite, option D, Lysol. The correct answer is option C, sodium hypochlorite. So this sodium hypochlorite, when it is being mixed with the water, we call it as a bleach. So for HIV contaminated body fluids, we have to, how we can destroy is by using the sodium hypochlorite. Next question is, endoscopic instrument or catheter sterilized by. So for endoscopic instrument, what we can do, how it can be sterilized. So option A, autoclaving. Option B, hot air oven. Option C, boiling. And option D, 2% glutaraldehyde. So for endoscopic instruments, bronchoscopy, so any kind of dialysis machines or scopes, we have to use the sterilizing material. Sterilization is 2% glutaraldehyde. So for 2% glutaraldehyde, we have to it kills the spores up to till what? Up to at least for 20 minutes we have to keep it. So this is the sterilizing sterilizing the instruments like endoscopes or bronchoscopes or any kind of dialysis machines. We can have to use a 2% glutaraldehyde for sterilization. So that's all for today's topic. So if you find this video to be useful, like it, share it and subscribe it. And if you have any doubt, kindly drop down in the comment box. So for who are preparing for competitive examination, it will be easy for you to learn in a very quick manner. Thank you for watching.